Here I am trying to explain how anesthesiologists have not much control over the length of surgeries. But the thing is, I know the Blue Cross Blue Shield insurance executives know that. They know that very well. Yes, I'm just really speaking to the public here, right? Surgeries have average length of time for which the surgery will be performed. And this average length of time will differ based on whether it's a private care facility, outpatient facility, in-hospital facility, a county hospital, a private hospital. And it will also differ based on the regions. There are many factors why a surgery may take longer. Yes, maybe due to the experience of the surgeon, due to the experience of the staff, in turnover, in cleaning the rooms and having the instruments ready. It could be due to the efficiency of the sterile processing room. It could be due to lack of instruments. It could change based on different anatomy in a patient. It could change due to a more complicated case. Doing a gallbladder removal surgery in an outpatient who does not have any inflammation or acute infection is very different than doing a gallbladder removal in a patient who has gangrene and sepsis, bile duct stones. The length of the surgery can differ greatly. What is Blue Cross Blue Shield going to use as the standard for surgeries? Surgeries that are booked for which you do not really know what you're getting into. Diagnostic lab, potential exploratory laparotomy. Because when the surgeon opens a patient, one may find extensive adhesions, which were not well read out in the CT scan. You might find cancer, you may find a mass, you might find abnormal anatomy. That will change significantly the course of the surgery. You may run into vessels, abnormal vessels. You may run into enlarged vessels. You may run into bleeding disorder. You may have excessive bleeding. You may be needing to wait for blood. You may have a patient complication due to patient comorbidities, due to patient's anatomy, due to the patient's disease state. So it baffles me just how do you cap an anesthetic time? What is that going to mean? Because legally, anesthesiologists cannot just walk off a patient in the operating room. That will be considered abandonment. You will be prosecuted. You will lose your license for doing that. You have to hand off care to a qualified anesthesia provider or to a qualified practitioner capable of resuming the patient's care, such as the PACU, step-down unit, ICU. You have to take your patient through the end of the surgery to the next phase of their care. So if Blue Cross Blue Shield executives know that anesthesiologists cannot walk off on a patient, what are they asking us to do? Do they want the public to direct their anger at anesthesiologists, right? Because the patients will complain. Are they finding a new scapegoat for the increase in prices? They can't just outright say, we're increasing the cost of your healthcare. They just can't say that. So they have to find a scapegoat that could be easily hated upon.